A diuretic is any substance that promotes the production of urine. This includes forced diuresis. There are several categories of diuretics. All diuretics increase the excretion of water from bodies, although each class does so in a distinct way. Alternatively, an antidiuretic such as vasopressin, or anti-diuretic hormone, is an agent, a drug which reduces the excretion of water in urine. Medical uses. In medicine, diuretics are used to treat heart failure, liver cirrhosis, hypertension, influenza, water poisoning, and certain kidney diseases. Some diuretics, such as acetazolamide, help to make the urine more alkaline and are helpful in increasing excretion of substances such as aspirin in cases of overdose or poisoning. Diuretics are often abused by those with eating disorders, especially bulimics, in attempts to lose weight. The antihypertensive actions of some diuretics are independent of their diuretic effect. That is, the reduction in blood pressure is not due to decreased blood volume resulting from increased urine production, but occurs through other mechanisms and at lower doses than that required to produce diuresis. Indapamide was specifically designed with this in mind, and has a larger therapeutic window for hypertension than most other diuretics. Types: high-ceiling loop diuretic. High-ceiling diuretics may cause a substantial diuresis, up to 20% of the filtered load of sodium chloride and water. This is large in comparison to normal renal sodium reabsorption, which leaves only about 0.4% of filtered sodium in the urine. Loop diuretics have this ability, and are therefore often synonymous with high-ceiling diuretics. Loop diuretics, such as furosemide, inhibit the body's ability to reabsorb sodium at the ascending loop in the nephron, which leads to an excretion of water in the urine, whereas water normally follows sodium back into the extracellular fluid. Other examples of high-ceiling loop diuretics include atterachronic acid and torsemide. Thiazides. Thiazide-type diuretics such as hydrochlorothiazide act on the distal convoluted tubule and inhibit the sodium chloride symporter, leading to a retention of water in the urine. As water normally follows penetrating solutes, frequent urination is due to the increased loss of water that has not been retained from the body as a result of a concomitant relationship with sodium loss from the convoluted tubule. The long-term antihypertensive action is based on the fact that thiazides decrease preload, decreasing blood pressure. On the other hand, the short-term effect is due to an unknown vasodilator effect that decreases blood pressure by decreasing resistance. Carbonic anhydrase inhibitors. Carbonic anhydrase inhibitors inhibit the enzyme carbonic anhydrase, which is found in the proximal convoluted tubule. This results in several effects, including bicarbonate accumulation in the urine and decreased sodium absorption. Drugs in this class include acetazolamide and methazolamide. Potassium-sparing diuretics. These are diuretics which do not promote the secretion of potassium into the urine. Thus, potassium is retained and not lost as much as with other diuretics. The term potassium-sparing refers to an effect rather than a mechanism or location. Nonetheless, the term almost always refers to two specific classes that have their effect at similar locations: aldosterone antagonists. Spironolactone, which is a competitive antagonist of aldosterone. Aldosterone normally adds sodium channels in the principal cells of the collecting duct and late distal tubule of the nephron. Spironolactone prevents aldosterone from entering the principal cells, preventing sodium reabsorption. Similar agents are eplerenone and potassium canreonate. Epithelial sodium channel blockers, amiloride and triamterene. calcium-sparing diuretics. The term calcium-sparing diuretic is sometimes used to identify agents that result in a relatively low rate of excretion of calcium. The reduced concentration of calcium in the urine can lead to an increased rate of calcium in serum. The sparing effect on calcium can be beneficial in hypocalcemia or unwanted in hypercalcemia. The thiazides and potassium-sparing diuretics are considered to be calcium-sparing diuretics. The thiazides cause a net decrease in calcium loss in urine. The potassium-sparing diuretics cause a net increase in calcium loss in urine, but the increase is much smaller than the increase associated with other diuretic classes. By contrast, loop diuretics promote a significant increase in calcium excretion. This can increase risk of reduced bone density. Osmotic diuretics. Osmotic diuretics are substances that increase osmolality but have limited tubular epithelial cell permeability. They work primarily by expanding extracellular fluid and plasma volume, therefore increasing blood flow to the kidney, particularly the peritubular capillaries. This reduces medullary osmolality and thus impairs the concentration of urine in the loop of Henle. Furthermore, the limited tubular epithelial cell permeability increases osmolality and thus water retention in the filtrate. It was previously believed that the primary mechanism of osmotic diuretics such as mannitol is that they are filtered in the glomerulus, but cannot be reabsorbed. Thus the presence leads to an increase in the osmolarity of the filtrate, and to maintain osmotic balance, water is retained in the urine. Glucose, like mannitol, is a sugar that can behave as an osmotic diuretic. Unlike mannitol, glucose is commonly found in the blood. However, in certain conditions, such as diabetes mellitus, the concentration of glucose in the blood exceeds the maximum reabsorption capacity of the kidney. When this happens, glucose remains in the filtrate, leading to the osmotic retention of water in the urine. Glucosuria causes a loss of hypertonic water and Na+, leading to a hypertonic state with signs of volume depletion, such as dry mucosa, hypotension, tachycardia, and decreased turgor of the skin. Use of some drugs, especially stimulants, may also increase blood glucose and thus increase urination. Low-ceiling diuretics. The term low-ceiling diuretic is used to indicate a diuretic has a rapidly flattening dose effect curve. It refers to a pharmacological profile, not a chemical structure. However, certain classes of diuretic usually fall into this category, such as the thiazides. Mechanism of action. Diuretics are tools of considerable therapeutic importance. First, they effectively reduce blood pressure. Loop and thiazide diuretics are secreted from the proximal tubule via the organic anion transporter 1 and exert their diuretic action by binding to the NaK2Cl co-transporter type 2 in the thick ascending limb and the NaCl co-transporter in the distal convoluted tubule, respectively. Classification of common diuretics and the mechanisms of action. Chemically, diuretics are a diverse group of compounds that either stimulate or inhibit various hormones that naturally occur in the body to regulate urine production by the kidneys. As a diuretic is any substance that promotes the production of urine. Aquaretics that cause the excretion of free water are a subclass. This includes all the hypertonic aqueous preparations, including pure water, black and green teas, and teas prepared from herbal medications. Any given herbal medication will include a vast range of plant-derived compounds, some of which will be active drugs that may also have independent diuretic action. Adverse effects. The main adverse effects of diuretics are hypovolemia, hyperkalemia, hyponatremia, metabolic alkalosis, metabolic acidosis, and hyperuricemia. Banned use in sports. A common application of diuretics is for the purposes of invalidating drug tests. Diuretics increase the urine volume and dilute doping agents and the metabolites. Another use is to rapidly lose weight to meet a weight category in sports like boxing and wrestling.